Well, good morning, everyone. Once again, how are you? And hope you're having a great start to your day. And we sure appreciate you guys coming on Q&A Friday, which is always a lot of fun. And unfortunately, I do not see any list or things going by me. I wish I did. Hold on a minute here. I got all my questions in front of me for today because it's Q&A. And we sure appreciate it. Okay, let me just see if... Yeah. Hi, everyone. Okay, let's wait a few seconds here. I'm assuming most people are on with us, but let's hold on. Just before we get to the first question, make sure everybody gets their notifications. Okay, good. And we love you dearly. Thanks for coming on. We appreciate all the questions that get sent in. None of that bothers me. Sometimes, actually, one question we got, I thought I answered this last week, but repetition is good, isn't it? So don't be shy. Send in your questions. We love them dearly. Hello to everyone, our faithful followers on Facebook. Hello, everyone, on the Doctor Is In podcast on your favorite smart device. We appreciate you guys coming on. Thanks for all the support. When you get a chance on the podcast, give us a 5-star review. Show us love. I'll tell you why. Because it really helps with the algorithms on the podcast. We got millions of downloads. We appreciate that. And it puts us at the top of these health podcasts. Okay, so thank you very much. We appreciate it. Lori, just wondering the full protocol if you have been diagnosed with Candida. Okay, well, numero uno, don't feed the bears. I should have put my t-shirt on. I do have a Martin Clinic t-shirt here. I've got one that says don't feed the bears, and I mean it, because Candida loves sugar. There's nothing that loves more than sugar. It's like cancer. What does cancer feed on? Sugar. Candida, yeast, fungus. It's the Trojan horse that comes into the bowel, sneaks into the bloodstream, carries toxins with it, heavy metals like mercury, lead, cadmium, aluminum. It brings it into the brain. It's able to cross the blood-brain barrier. It's very toxic, and don't feed it. You got to starve it out. And Candida hates steak. It hates steak, okay? Can't feed on it. So what do? Eat steak, eat eggs, eat cheese. Candida loves sugar or anything that turns to sugar rapidly. Bread, pasta, cereals, rice. I wouldn't eat it. You got Candida. And don't drink any juices. Lay off that stuff. Don't drink milk. Can have some dairy, butter, of course. And, okay. And then what else do you do? Well, probiotics, especially with our formula where we have an immune busting formula. It busts into those Candida. It's L. reuteri and L. rhamnosus. But I love the very high density Acidophilus. Okay, and I love, so probiotics, 100%, okay? And don't feed the bears, the big thing. Oil of oregano kills Candida. I know, I talk about oil of oregano all the time, but there's nothing better under the sun than oil of oregano. Natural antibiotic, natural antiparasitic, natural antifungal, yeast, kills it. Oil of oregano, use it. Brush your teeth with it. It's a way of getting it. Put a few drops in water if you have to. Like whatever which way. And of course our digestive enzymes have oil of oregano in it. I love oil of oregano. Okay, so it kills SIBO. And you know what SIBO is? It's SIFO. Small intestine fungal, candida overgrowth. That's what happens there. If you got bladder, guess where yeast goes? To moisture. It loves it. Kill it. Okay, thank you very much. That was Lori. Vasco. I did Dr. Martin's cancer protocol 3 months ago. That is for prostate cancer. I did it for a month. Stay on it. Vasco. As much as possible, stay on it. Because the protocol has a lot to do with food. And you're avoiding sugar, cancer. And you're dimming out your estrogen. Big time important for prostate cancer. Prostate cancer and breast cancer, they're identical twins. Except one is a male and the other is a female. Okay? I've been saying that for 50 years. People prostate, why do we see so much prostate cancer today? Why do we see so much breast cancer today? The world is loaded with estrogen. It's a growth hormone. Insulin, a growth hormone. Why do you want to lower your insulin? It's a growth hormone. So is estrogen. Estrogen makes you a woman, and it makes a man a woman too. It's a big problem in our world today. Men don't have enough testosterone. Okay? Anywho, there you go. That was Vasco. Okay. Janine, I'm almost on all of your supplements and 15 weeks doing the reset. On a 15-week doing reset. Good for you. My hair is shedding a lot. Should I be adding extra biotin? Listen, if you're asking me, which you are, I like bone broth better. Like biotin's all right, but it's not magic. There's no magic. And the other thing is, Janine, check your thyroid. Because even though, testing might be normal for the thyroid, I like the thyroid formula to stimulate hair growth. I find it to be very, very good. Okay, that's a great question, Janine. Thank you for that. Michelle, what do I think of Ehlers-Danlos syndrome? Well, I don't think much about it because I don't see it a lot. But anyone that has it, Ehlers is a connective tissue. It's a genetic thing. It's a defect in the genetics. And they get a connective tissue disorder. Very, very loose joints ordinarily. I've seen it. I'm trying to think. Loose joints, inflammation quite a bit. And they got to be careful, even cardiovascular, like they can get what they call an aortic rupture because of connective tissue. So you got to be careful cardiovascular wise, okay? And what I'm trying to think, I just sort of treat like, look, you ain't going to fix it. But I would treat, I'd have them on bone broth. I had them on probiotics. I had them on curcumin for inflammation. Trying to think what else. Vitamin D. Check those levels. B12. Always check them because they're probably deficient. Anywho, there you go. That was Michelle. Thank you for that. Anna, my lipase is 96 and I'm wondering how to lower it. Well, lipase is a measurement of an enzyme. They can do that lipase, and they usually do it when they're checking 1 your pancreas. So people that get pancreatitis, which is a real, can be a very serious disorder, their lipase goes up. It's one way how they diagnose it. And, the gallbladder and the pancreas are connected. And, I always check lipase, like if lipase is elevated, gallbladder, you might have stones that might have lodged into the pancreas. You've got to be very careful about that. But at the end of the day, your pancreas, we see so much pancreatitis today. Why? Because we don't eat the right foods. We live on fiber and fruits and vegetables and a lot of grains and a lot of carbs and a lot of sugar. Your body wasn't designed for that. You got a gallbladder so that you can eat meat and eggs and cheese. We don't use it. You don't use it, you lose it. And pancreatitis is part of that. And because you're overusing the pancreas is secreting insulin. People, in my experience, they get pancreatitis, they're carboholics. My name is Tony and I'm a carboholic. Okay? Are you? No, but generally, I talk about gallbladder all the time because it's use it or lose it. That's how you get stones. You didn't use it. We bought the lie of fat-free and cholesterol-free and don't eat that stuff and limit that stuff and salads are better than anything else on the planet. No, they're not. It's not even close. But there's a lot of propaganda out there, and that's why a lot of people get pancreatitis. They're using that pancreas way too much, and their lipase goes up. Their gallbladder forms stones, and their lipase goes up. Okay? Okay, I answered this, Debbie, last week, but I'm happy to do it again. Okay, I'm wondering what Dr. Martin thinks of food-grade hydrogen peroxide therapy. I don't. Okay. I'm reading a book that says it cures all sorts of things. Debbie, you know my rule of thumb. When you hear something that sounds too good to be true, it's usually too good to be true. Look, I know people say this, we've already found the cure for cancer and the pharmaceutical companies are hiding it. Well, cancer's complex, okay? The greatest cure, and I hate to use the word cure, the best treatment for protecting cancer, I've been talking about that all week this week. Okay? And don't feed it. Cancer needs to be fed. It needs fuel. It's ravenous. We've known that since 1928. The fermentation process, the sugar, it's ravenous. Okay? Hydrogen peroxide, I know it's been around. I got that on my desk 35, 40 years ago. Cures everything. I don't buy that. Like hydrogen peroxide isn't even close to what vitamin D is. There's no comparison between hydrogen peroxide and the sun. There's no comparison. So when people tell you, well, it cures cancer, run, Forrest, run. I don't buy it. I'm not saying, look, if you had cancer and someone said to take a little bit of hydrogen peroxide, hey, do it. You know what I used to tell my patients, Debbie? I used to tell my patients this. I think I said it every day for a lot of years. If I thought hanging you upside down from this building that we're in would help you, we'd go on the roof and I'd hold your feet and hang you upside down. Look, I'm not against anything. I'm not against it. You want to use hydrogen peroxide? Go for it. I got no problem. If you got cancer, you want to go to Mexico, you want to do, hey, I'll give you a high five, man. But here's what I know. I don't buy it with the hydrogen peroxide. Why? Because I haven't seen it. I know people that tried it and they had 4th stage. I remember a woman came in my office. What kind of cancer? Esophageal, I think. She said, oh, I'm going to be cured by this. I read about it. I said, well, I didn't want to discourage her, but in my head, and I made notes on her file, and it didn't work. Look, I get it. I know some people write about stuff like that. I'm skeptical. It's not easy to fix cancer. It really isn't. And, like now they're talking about ivermectin and that kind of thing. Like that's the hottest thing since sliced bread. And if people don't like when I use that terminology, I'm not telling you to eat sliced bread. It's an expression. I'm full of them. Haven't you noticed? Anyway. And now ivermectin and people are trying to find it and it's a dewormer or whatever. Look, listen, if you got cancer and you can find it and it helps you, I'm going to be the first one in line to give you a high five. I'm happy. I'm on your side. But I've read the studies on ivermectin. Look, if I had cancer, I'd be taking it. Does it cure all the cancers? No, it don't. It really doesn't. But it should be part of therapy for the results that chemotherapy gets and radiation therapy and slash and burn therapy. Cheapers. I like ivermectin compared to that. Do you know what I'm saying? Do you get the drift? I'm not against any kind of therapy. I'm not against it. But when you ask me, does it work? Well, that part I'm not convinced of. I set up a protocol for cancer. Is it cure every cancer? No. Is it a good protocol? Yeah. I'm big on it, but, okay? I'm trying, and you know me, because I've been consistent about this. I am trying to prevent cancer. Because you're always fighting cancer. So I'm big on preventing cancer in the first place, because we don't talk about prevention. We talk about detection and then treatment, because that's the pharmaceutical / medical system that you and I live in. It's all about detection, and I'm not against detection, and treatment. I'm not against treatment, but really, the cancer industry is a big industry. I do not give 1 red cent to the Cancer Society because they don't give their money to research. And I believe me, I've been around a long time. They do not spend 1 nickel on prevention of cancer. They don't do it. It's detection and treatment. And the treatment hasn't changed much. Oncology is the same as it's been 60, 70 years now. It's the same. Their drugs are a little bit, it's still mustard gas, but, refined a little bit. And I'm not that happy about that, but what do you want me to do? We live in that system. But anyway, okay, thanks for the question, Debbie. I appreciate it. Look, the 1 minute cure. I don't buy it. Amanda, on my lab results, my TMAO was high. It says to avoid red meat. No, that, they don't know what they're talking about. Okay. What is that called again? Trimethyl, ammonine, hold on a minute. Nitric oxide. N-oxide. Your TMAO was high? Okay. Usually when I found that to be high, they were diabetic. They were type 2 diabetic. And the worst thing you can do is avoid red meat. That's the worst thing you can do. Don't do that. Avoid sugar like the plague. That's what you should do. Avoid the crappy carbs like the plague. That's what you should do. I know they talk about you need fiber and you need this and you need that. It's propaganda. It's not science. Since when is red meat not better than everything else on the planet in terms of food? Listen, I'm a nutritionist. How many vitamins, amino acids, minerals are in steak? Everything. Okay. Then compare that to anything else. It's the opposite. Okay. That was Amanda. Should I cut that down? Don't. You know what, Amanda? I get it. You're confused. I get that because there's two schools. Well, there's more than two, but there are two big schools when it comes to nutrition. The biggest school is dietitians, the medical establishment, a lot of gurus, and they got a big school and they're on a broad road. Okay? I love it. The Bible talks about this. Okay, Jesus talked about two roads in Matthew chapter 7. Okay? He said there's a broad road and everybody's on it. He said everybody's on it. It's popular. But it leads at the end to destruction. And what he said is get on the narrow road that leads to life. There's very few on that road. It's not the popular road, but it's the right road. Jesus said that. Now, when it comes to nutrition, there's the wide road. Everybody's on it. Vegetables, fruit, they're the greatest thing. You can't live with it because they're alkaline. And meat causes cancer. And it's acidic. And you were not meant to eat meat. And it's bad. And yada, yada, yada. But that's the broad road. It's popular. You get kids today, they're vegetarians or vegans. Why? Well, I can't, Dr. Martin, I can't have anything that's got eyeballs. I couldn't eat that. And they're on the broad road. It's popular amongst young people like crazy. Fiber. It's the best thing ever created. As if you have a large poo, that is good for you. I don't know. But the narrow road is the right road. And I've been screaming Get on the narrow road. Jesus talked about it spiritually. I'm talking about it physically too. Narrow road. It's not the popular road. There's few on it, but it's the right road. And you know me, you want to hear the other side? Just turn on almost every other podcast. But it's not true. Okay? It's not true. Why did I get so excited? Okay. Joanna, I have a friend who has a tiny poke. She doesn't know what turned it into an ulcerated leg wound. The doctor is saying it's not healing properly because of poor blood circulation. And they're saying it's pyoderma granulosum, which is a rare skin disease. Yeah, that is rare, but I've seen it. It's leaky gut, 100%. Autoimmune. The body's turning on itself. Usually there's a lot of fungus, candida involved. Don't feed it. Get off all the sugars. Get on probiotics. Get on oil of oregano. I would be on bone broth. Thank you. Okay. Judy, is it safe to use castor oil for a laxative for a short period of time? Yeah, very short. Castor oil, I like it for external use. Okay? My grandfather used to use castor oil on the belly. And he liked it. I never talked to him about it, but my dad talked to me about it. But I see castor oil more as for on the external, not on internal. Okay? And it can be a laxative, I guess. You know, but be careful with it. I wouldn't use it much. Okay. That was Judy. Thanks, Judy. Helen, my husband has diarrhea. It's often at night. He had his gallbladder removed due to polyps. Okay, well, that'll give a lot of people diarrhea. But he had this before, I think. Yeah, he had explosive bowel movement even before his gallbladder was removed. Well, look, I suspect that he has bile acid malabsorption, possibly that the liver is making up too much bile, because that's what it is. And one thing I would have you check, Helen, is if he's got that condition, he's got low B12, because he's not making the intrinsic factor in his gut. So check his B12 levels. Watch fiber content. Wouldn't eat a lot of that. Try and do eggs, meat, and cheese, even though he doesn't have a gallbladder. He's got to be careful, and then not too much fat. Try and be careful about that. Okay? Okay. That was good. And I'd have him on digestive enzymes big time. Big time. What is the quickest way to get B12 up? The shot, a supplement, prescription pills. My blood work is very low in B12. Nativity, the quickest way is, the best way is a sublingual B12 every day. I love B12 shots. I got no trouble with that. Okay? But the best and this has been proven, by the way, in studies, that when you take a B12 sublingual, under lingual, tongue, okay, language, okay, sublingual, let it melt in your mouth, sublingual. That's the best, because you can top it up every day. And I showed that to patients over the years. But I love B12 shots too. I mean, B12 is good for you. You know me and B12, Nativity, okay? If you're low, you're not making the intrinsic factor. You can't just get it from meat. And we've been putting out a whole series of emails on B12 in the last little bit, okay? Just because it gets missed so often. Doctors today, it amazes me compared to my dad and those people in those days. B12 was everything to a doctor in the 1950s. Oh, you're tired? B12. You don't feel good? B12. They had it in their doctor's bags to give you an injection of B12. And today, they hardly know what it is. Because they don't, unless your numbers are, even when your numbers are low, they don't want to give B12 shots anymore. There's very few doctors that do it. And it's crazy because it's vitamin D and B12 in medicine is you got to pull their teeth. Bring them to a dentist without anesthetic to make them think about it. They don't associate B12 deficiency with anything anymore like they used to. Okay, anemia, and they just don't look at it. Some do, I know you got a good doctor, good for you. Here's a high five. But most doctors, they're not trained in B12 anymore. They don't look at it. They often don't even order the test of B12. And it's like vitamin D. I've talked about this every day. Vitamin D, all they think of is bones. Because that's what two things. They're taught bones, vitamin D. It's good for something, bones. And they're taught toxicity. And that's even bigger. Woo, you're gonna die. You got too much vitamin D. You're going to die. Today, I think. You're gonna die today. You got too much vitamin D. That's their training. They don't even think of vitamin D and cancer. You were talking, or someone who was talking about that, like, hold on, let me get it. Debbie, you were talking about hydrogen peroxide. I'll tell you, it don't even touch what vitamin D does for you. Not even close when it comes to your immune system and vitamin D and fighting cancer and your natural killer cells and your T cells. It's not close. But they don't want that. And there's a war on that. There's a war on B12 too. There really is. It's more subtle. B12 war is more subtle. It's just ignorance. They don't know anything about B12. Well, your body don't work without B12. Your nerves don't work without B12 properly. Your brain can't work without B12. Your metabolism doesn't work properly without B12. Weight loss. Dr. Bernstein, he had clinics all over North America. He put you on a huge calorie restriction for weight loss. And then the good thing that he did is every week you'd get a B12 shot. Because he knew if you don't eat much, I better give you B12. Oh, anyway, I get it. I get all uptight because I just, Okay. That was Nativity. Thank you, Nativity. Bree, I was told I have gallstones and intermittent pain with them, that my only option was removal. Well, maybe, Bree. Okay? Again, modern medicine there's some wonderful things they do. Because if you get a stone that lodges in a duct, especially that pancreatic duct, it can kill you. Okay? So I didn't fool around with that stuff. Okay? I didn't fool around with a pancreatic blockage because of a gallstone. It can happen. I've seen it happen. Okay? I've seen it happen. So, like, I'm very careful. Very careful, okay, with that. What foods really gotta go because of the situation? And by the way, Bree, the reason it happened, you weren't using your gallbladder. Don't be offended. Okay? I'm telling you. I saw it 10,000 times. Well, maybe not 10,000, but a lot. Use it or lose it. Gallbladder. And the only reason you get stones is because you weren't eating enough eggs, meat, and cheese. Okay? But now you've been converted, Brie. Okay? Now you're converted. You believe. Okay. But you got to be careful on the fat part because the stones are there now. Okay? Have I seen them dissolve on their own? Yes, I've seen it. Okay? With not eating at night, careful management, okay? Lowering the fat, giving yourself a lot of time to digest food, go at least 14, 16, 18 hours if you can, and do that intermittent fasting. I find that can be very helpful. Drink a lot of water. And one thing you might look at is elevating the progesterone, because smooth muscle, especially in women, is very reliant on progesterone. Okay, that's why women get fibroids. They don't have enough progesterone. They have too much estrogen. And that's why women often lose their gallbladder after a baby. All the progesterone is gone. And you get the postpartum gallbladder. A lot of women lose their gallbladder after baby. Why? Where's all the progesterone gone? It's gone. It was in the placenta, and your body didn't make up enough to replace it. Okay. Thanks, Bree. You should be on digestive enzyme. 100% for sure, too. That really helps with that. Probiotic digestive enzyme. Debbie, I am on a low-carb diet. You're a smart girl. Mostly eggs, meat, and cheese. You're smart. I'm on your vitamins. D, B12, probiotics, cortisol, digestive enzymes. Quercetin, pine bark. You're a smart girl. Are you missing anything? It doesn't sound like it. You got the ones that I like. Good for you. You feeling good? You know, I talked to someone yesterday, okay? We talked about investments. Okay? We talked about investments. And I said, because someone asked me, Dr. Martin, all these supplements. Well, here's the way I look at it. Okay? One, we live in a different world. Food isn't what it used to be. I measured. I didn't even guess. I tested. I saw so much deficiencies. It was crazy. Okay? I saw so much leaky gut. So you know me. I'm big on probiotic. I think everybody should take it. I think your dog should take it. I'm big on B12. I take it every day. You know, do I think people need it? I know they need it. Vitamin D, do you need it? I know they need it. So, supplement. You know me and DHA. I'm investing in my future for my brain. Because your brain is made up of DHA. And I need this thing. Okay? I don't know about you, but I do. My eyes. I want my eyes to last. I love DHA. I love Navital. I tell you guys, the reason I created my own products, my son and I, why do we do that? Well, I want the best. I wanted people, I had to look at people in their eyeballs and say, I told you. They work. Your B12's gone up. Your vitamin D has gone up. Your eyes are better. Your brain is better. Your gut is better. I had to look at people in the face. I used to tell people, like you can look at all these vitamin companies or whatever. They don't look at people in the eyeballs. I did for 50 years. I had to get results. I had a good reputation because I got results, not because I was good looking. No, but guys, seriously. People came from all over. I had people from Europe get on an airplane and come and see me. I didn't even know how they heard about me. I took that seriously. I took my job seriously. Okay. I said, you taking me serious? I take it very seriously. I take your health seriously. I did. And, I was very opinionated. Yeah. Okay. There it goes. Okay. But I used to tell people, you do what you think is right. I don't want you cannot out-supplement a bad diet. You can't do it. So, you know me. Foundation was food. You got to eat anyways, eat the right foods. And I said it, and I said it to everyone. I said it to 5-year-olds in my office. You're not stupid. Lay off the sugar as much as possible. They understood that. You can't live on pizza. No. I take their little face and I go, you can't live on pizza. I know you like it, but you can't live on it. Okay. People are smart. And then I talked to them about supplements, and I talked about, correction of conditions, and then I talked to them about prevention. I'm big on that. So I said, Dr. Martin, it costs money. Yeah, I know they do. I'm very sensitive to that. Okay? So diet, you got to eat anyways. Supplements, it's an investment. You can have all the money in the world in the bank and you don't have your health. What do you got? True or false? Right? I'm not looking at quantity of life. Okay? I look at quality of life. That's what generally, sure, I want to live. I do. Okay? But I want to be healthy as much as I can. And, I understand I don't control everything because you can get hit by a bus. You can be the healthiest person in the world. Look, it can happen, right? So what am I saying? You got it? Supplements. Are you taking everything? That's up to you. Nobody puts a gun to your head. But I believe in investing. You want to invest in the stock market? Well, good for you. But I believe in investing in health. I believe in responsibility. Taking your body, your health, you take control of it. My parents, what they did, not my dad, but my parents' generation, they relied on doctor. You get older, I talk to a lot of people every day. I do. I talk to a senior. How many meds are you on? 15? You're on 15 medications every day. Yep. Why? Well, my doctor. I said, 5 of them that I looked over the meds were for side effects of the other meds they were taking. I said, here's what I actually said. Boy, your pharmacist must really like you. Like, guys, hey, I'm not even telling people. I never told that person or anyone else not to take medication. I don't do that. I just tell them, you want to listen to me? You want to listen to an old goat like me? Here's what I got to say. Food. Look for deficiencies. If you're a senior, you're low in vitamin D and B12 almost for sure. I can almost guarantee it. Oh, I didn't know that, Doc. Yeah. That's why I'm telling you. Okay, well, we're done, and I got to do this. I guess we're having Monday. And Monday in Canada, it's a long weekend, but we're on. We're on. Lord willing. Okay? Now, I didn't realize I'd gone for so long. Okay, we love you guys. Thanks for being with us today. We appreciate it big time, and we are going to be on Monday. Hold on, I'm just trying to get on here. Looking to see what next week. I got some real good studies, but anyway, we'll leave it at that. Okay, talk to you soon. Love you.